Have you ever said your suction sucks?
Yeah, all the time. But what about if you're that patient that's just like they're from The Exorcist? So today's 2-minute tip.
We'll cover a few tips on how to help you grab that airway.
Gravity's your friend, right? So we want to elevate that patient's head. Even if they're on the spine board, we want to lift them up.
What are you talking about? We weren't taught that in paramedic school.
Yeah, it's easier than you thought to innovate this way.
Agree.
So I'm going to lead with suction. I'm going to place that Ducanto catheter in, and I'm going to lift.
At this point, Ren, I think take the Mac 4 or your VL and slowly walk it down midline, doing epiglottoscopy.
Yeah, it's a hard word. Epiglottoscopy.
Get a good view of the
There it
vocal
is.
cords and just park that Ducanto in the esophagus to the left side of the... 2 Ducantos are better than 1. Patient's still vomiting. Right now, you're using the Ducanto just like you would an ET tube. Can you see the cord?
It is placed right into the trachea past the cord.
Outstanding. I'm now going to pass the Bougie through the Ducanto.
So do you go with the coude tip side or the straight side?
You know, that's interesting that you say that. And I do agree with you that the coude tip side, you're more likely to get hold up at the base of the colon. So we're going to hold hands. So I'm going to stabilize the Ducanto and the Bougie coming down. I'm going to slowly pass that Bougie down the Ducanto.
So I'm continuing to look down the airway because I want to make sure that Ducanto catheter is in there and I don't migrate and that I lose where my position is.
That's a great tip, Bren, because I think that's one of the most common mistakes people make is as soon as the Bougie goes down, they immediately pull the blade out and it can migrate in the hold up.
So I'm going to gently pull back on that Ducanto catheter.
And I'm holding steady downward pressure on the Bougie, so do not migrate out. You have the Bougie, I've got the Ducanto.
Yes.
Ducanto coming out. I'm going to preload your tube right now. Tube's coming down. I have the Bougie.
I'm passing the ET tube. The ET tube's going to go just past that radiographic line. I have the tube.
All right, I'm pulling the Bougie out. I'm going to put my hand on top of yours to stabilize it. Bougie is out. Cuff is inflated.
Tube still in. I'm going to remove my laryngoscope.
Well done.